Hello, Gazelle and Lindsay. Welcome to my presentation on tuberculosis and pregnancy. Tuberculosis, or TB, is a potentially dangerous infectious disease which primarily affects the lungs. Bacteria causing TB are passed from one person to another via tiny droplets spread while talking, sneezing, coughing, etc. Once infected, a person may not exhibit symptoms, which is known as a latent infection, and can cause the disease days, weeks, or even years later. If active, it is known as TB disease. Treatment can occur during either phase and can prevent the active disease or the spread of it. Those most at risk are people living in crowded living conditions, such as military bases, the inner city, or refugee camps. It is more common in certain parts of the world, such as Asia, Africa, and Latin America. Anyone who has had recent contact with someone who has had TB is at risk, and those with HIV, syphilis, or other immunocompromising diseases are particularly at risk. As you can see, symptoms for TB are common for many other diseases and infections. So it is important to be aware of the living conditions and people that at-risk populations are in and around. TB has been and is a global emergency. A person can be infected, as we've talked about, and not know that they are. If untreated, there is up to a 40% mortality rate, and for those with HIV, the risk increases by nearly 300%. TB is hard to diagnose, and many with it are missed. The World Health Organization, or WHO, estimates 3 million cases are missed annually. In 2014, WHO estimated that 3.3 million women developed active TB the previous year. This resulted in 510,000 deaths. Of those, 180,000 were also HIV infected. TB is the leading cause of death of those infected with HIV. Treatment is usually very effective. The exact course of treatment depends upon several factors, including whether the TB is latent or active, if the infected person also has HIV, if the person is pregnant or lactating, or if a child is infected. I'm not even going to attempt to list all the possible treatments because there are so many, and I also don't want to mispronounce them, but they do exist and they are effective. TB should be treated during pregnancy because if left untreated, miscarriage, premature labor, small babies, and the small chance of an infected baby exist. If the birthing parent is active at the time of birth, the baby must be separated after birth. If a pregnant person wishes a home birth, referral to a backup physician is indicated. Worldwide, TB is the leading cause of death among women of reproductive age. Testing should be routine in order that treatment can be carried out. The prognosis is good for both pregnant person and infant if under treatment. We in the U.S. are fortunate in that there aren't that many cases of TB here. However, that is not the case worldwide. TB testing needs to be available and offered to all people of childbearing age. Governments need to commit to helping their own population and others if able. Clinical and laboratory staff need better training, and health facilities need to be properly equipped. So there you have it. TB is a pretty serious thing, and there is so much more that we could be doing to help. I hope you enjoyed it, and I'll talk to you soon.